Afulocin. Detailed information about the drug Afulocin is an antibiotic belonging to the fluoroquinolone class of drugs, with a bactericidal effect. The drug is used to treat bacterial infections caused by bacteria susceptible to the drug. Active ingredient: Pefloxacin mesylate. Dosage form: intravenous solution for infusion. Mechanism of action: Pefloxacin is a potent inhibitor of DNA gyrase, an enzyme essential for bacterial DNA replication. By inhibiting DNA gyrase, Pefloxacin prevents the reproduction and development of bacteria. Pharmacokinetics: absorption: Pefloxacin is well absorbed from the gastrointestinal tract. Distribution: the drug is widely distributed in tissues and body fluids, including cerebrospinal fluid. Metabolism: Pefloxacin is primarily metabolized by the liver into inactive metabolites. Pharmacokinetics: elimination: Pefloxacin is primarily eliminated in the urine as the parent drug and metabolites. Half-life: the half-life of Pefloxacin is approximately 6.2 to 13.8 hours. Major metabolites: dysmethylpefloxacin, a metabolite with antibacterial activity. Pefloxacin oxide, an inactive metabolite. Indications: Afulocin is indicated for the following conditions: urinary tract infections, cystitis, urethritis, pyelonephritis, prostatitis. Respiratory tract infections, pneumonia, bronchitis, otitis media. Skin and soft tissue infections, dermatitis, abscesses, wound infections. Indications: bacteremia, bloodstream infections. Endocarditis, inflammation of the inner lining of the heart. Meningitis, inflammation of the meninges. Dosage and administration: dosage: the recommended dosage of Afulocin for adults is 800 mg day, divided into 2 doses. For achieving effective blood concentrations, an initial dose of 800 mg can be used. Administration: the drug is administered by intravenous infusion slowly over 30 minutes. Dosage adjustments. Dosage and administration: patients with liver impairment may require dosage adjustments by increasing the interval between infusions. Patients with renal impairment may require dosage adjustments based on creatinine clearance. Dosage and administration: patients with liver impairment may require dosage adjustments by increasing the interval between infusions. Patients with renal impairment may require dosage adjustments based on creatinine clearance. Dosage and administration: patients with liver impairment may require dosage adjustments by increasing the interval between infusions. Patients with renal impairment may require dosage adjustments based on creatinine clearance. Contraindications: hypersensitivity to Pefloxacin or any component of the drug. Patients with a history of epilepsy. Patients who are pregnant or breastfeeding. Adverse effects: adverse effects that may occur with the use of Afulocin include gastrointestinal nausea, vomiting, diarrhea, abdominal pain, nervous system headache, dizziness, drowsiness, skin rash, itching, urticaria, liver elevated liver enzymes, kidney renal impairment. Adverse effects: cardiovascular arrhythmias. Precautions: use of Afulocin with caution in patients with a history of liver, kidney, cardiovascular disease, or epilepsy. Monitor serum biochemistry regularly during Afulocin use. Do not use Afulocin in children under 18 years of age. Do not self-medicate. Consult your doctor before using the drug. Note: the information provided in this article is for informational purposes only and should not be considered as a substitute for professional medical advice. Always read the instructions for use carefully before taking the drug. Store the drug at room temperature, away from direct sunlight. Note: keep the drug out of reach of children. Do not use the drug after the expiration date. References: Afulocin package insert. Medical literature related to Pefloxacin. Conclusion: Afulocin is an effective antibiotic for treating bacterial infections. However, the drug may also cause some adverse effects. The drug should be used as directed by a doctor to achieve optimal therapeutic effects and minimize adverse reactions.